Okie dokie. So I know that I've got a couple of you here that I know so well, and it's really nice to see all of you again. And for anyone watching this as a recording, I'm just going to introduce myself before we get started. It's Friday evening, so thank you for those joining live and giving up an hour of your time this evening. This is going to be about the pregnant student, and I am Vix, and I'm an osteopath and a registered osteopath and a yoga instructor in the UK. I graduated in 21 from osteo uni and straight away fell into pregnancy and postpartum clinical work. The first clinic that I got a job in, they asked me to because I was an osteopath and they were chiropractors for some reason, they said, "Oh, well, then you're going to be our pregnancy, our women's health person." And I panicked, of course, and went and did a bunch of courses. And one of those was the mummy MOT and some further training in pre and postpartum exercise and rehab and all of that. So since then, I've been really interested in this topic because I think, first of all, pregnant people and really postpartum people get very little support here in the UK anyway. And especially when something goes wrong, people often come in and they just not they didn't really know where to turn. And I've also, as a yoga teacher, I've also been teaching pregnancy since 2016. And for me, going through university and learning a lot of in-depth anatomy and pathology and all of that, I realized that actually a lot of yoga teachers are quite worried about pregnancy. And it's probably because there's quite a bit of scaremongering out there, of course. It's if you, I'll show you on the next slide. It can be a little bit nerve-wracking and it can be a little bit difficult. So I decided about 6 months ago, most of you on the live call know this already, to give up my full-time clinical work to go back to the teacher training. So I founded the Yoga Teachers Lab, which is an online CPD, which is continuing professional development. It's just a term that people use in lots of different industries for courses. So when you graduate as something, a lot of industries offer CPD so that you continue to develop your knowledge for that career. And so that's what I've done. I've taken tips and tricks and lots of knowledge from all the CPD platforms that I've used over the years, like Physiopedia, and I've created this little CPD platform. So that's what I'm up to full time. In this picture, I don't know if you live people have seen this. This is me at my pregnancy yoga training all those years ago, and I'm not actually pregnant there. That is a pillow. That's Timo, my partner. That was my graduation day. And down here was a picture of a really, really cool patient that I used to see. She used to have really bad pelvic girdle pain. And that green pillow you can see at the bottom, that is a pregnancy pillow. So even at 36, 7, 8 weeks, they can lie face down in that. It has a hole for the breasts and a hole for the bump, and it's absolutely incredible. They asked me if they can just pay me to borrow it all the time. So why are we here today learning this? And I want to just set the tone for this class. As it's Friday and as it's a big topic, I just want to say that it's going to be up to 60 minutes. I'm hoping we're all done at the 60-minute mark. So I will keep you on mute and we'll do questions at the end if you want to stay later, and at the end, if you want to ask anything else, you can. So I will just stop teaching at that point, and we'll do questions just before that point. So the journey with me today, we're going to be here for an hour, and we're going to have a look at the physiological changes that happen during pregnancy. Let's just go inside and have a look at what's actually happening. And usually it's the fear of the unknown with these sorts of topics, and the whatever the grapevine says at the time that causes us to be really scared. Really, we have no reason to be scared of pregnant people. The first thing to really think about is a pregnant person is not sick. They're not poorly. It's not a disease or condition. It's a very natural thing. The body's been doing it for a long time, the human body. So that's what we're going to do there. And at the end, we're going to have a chance to request I've put together like a summary of all of this tonight, which is like a little handout. We're going to also look at some of the five main conditions. That means disease, like conditions as in physical conditions that can happen in pregnancy, and exactly what we need to do about that. We're going to think about the yoga side of things, modifications, and how we can get you to feel really confident with pregnancy. So in the bubble in the middle, you'll see that this is actually, I'm not sure if she's even here, but this is one of the students from the lab actually. And she wrote this to me the other day. One of my students informed me she was 5 months pregnant, and I have been crash reading everything I can do to support her, as well as finding pregnancy classes close to where she is based, because really she could be attending these to her benefit instead if attending a general class. So that person I know is someone that's been teaching for about a year. It's community classes, and she kind of went online and looked all over the shop to see like what are the tips. And I decided to go and have a look myself at what we might find if we Google this. So what do we find on the internet? I'm confused. I'm scared. I've had somebody come in 5 months pregnant, and these comments have come mainly from Facebook, one or two from Google. So number one, top left, is congratulations to you and your daughter. This was a comment. This is just a post that somebody made. My advice is to stop her dynamic practice until she's had the all clear at her first scan at 12 weeks, as the risk of miscarriage in the first trimester is higher. So that message there is saying don't let her come to yoga, put it off until the 12-week scan, and that's because the risk of miscarriage is high. So if I were that person who's been teaching for 1 year, I'd be thinking, right, yoga can cause a miscarriage in the first trimester, so I need to be very careful. So park that. I'm not saying I agree with that. Park that thought, and also any questions you have, you can also write them into the chat as well today. That way we can keep this moving, and I can deal with anything you have at the end if possible. The second one, I continue my practice and cycling and swimming and climbing until late pregnancy. First trimester, I sometimes had to slow down because of hormonal changes. So this is almost the opposite to the first comment. So this person's like, well, I continued everything. I was cycling, swimming, climbing. So she actually was climbing in the first trimester, where the person on the first comment was saying stop them from doing everything. The third comment, if she practices regularly already and feels up to it, there's no reason to stop a practice she is used to. As long as she listens to her body, nothing in the first trimester is for people that do not have a practice or do not have a regular practice, and it's also to protect teachers. So the person there on the right is saying, the person on the left, don't let them come to yoga, is right if the person is not a regular practitioner. Bottom left, she shouldn't be doing any exercise such as yoga for the first 12 weeks, at least until her first scan. The first trimester is the most dangerous for miscarriages. Wow, so I'm feeling completely confused. I don't know what to do now. Do I need to ban this person from my class? Probably I'm going to be thinking yes, because I'm so scared by some of these comments. One of them, two of them kind of disagree. It's very confusing. She can continue safely practice inversions, etc., as long as she's had these in her practice and felt comfortable doing so. So there's that comment is saying that not only can she stay, you can get her upside down if you want, do some headstands. So yeah, that is what you find on the internet. So that's what we're demystifying today. Yoga when pregnant. This is what we get. What's the truth? So that's where I come in. So as an evidence-based osteopath working in women's health with quite a few years of experience as well teaching pregnancy, I want to offer you an evidence-based approach. That means I'm not going to give you my opinion. I'm not going to say what happened to me or what happened to my friend. I'm going to tell you what the research says, and the research is always an average of all of the results. So it's not just reading one study and taking that as gospel. It's actually evidence-based medicine is more about saying, well, based on everything we've tested, this is what we think is the right thing to say. So evidence-based practice is, in my opinion, the best way to go. It means that it's pretty safe, and yeah, we can be confident that we're giving the right options. So let me take you on a little scenario. So this is the scenario that I get often. Students come to me, teachers come to me, and they say, I've been teaching just like the lady in the first comment back then, 5 months pregnant. She's come up to me right at the beginning of the class. So the class is starting right now. They've walked in 1 minute before the beginning and they've said, "Oh, I'm pregnant, 5 months." And you look at them and think, "Kill me now. Kill me now." I've had this moment myself back in the beginning when I first started teaching 11 years ago, and I was quite a nervous person, I think, and I think we can all resonate with that moment where your heart sinks. It might be because someone asks you a question you really don't know, or or someone comes in like this and you're not prepared. So you say, take it easy. You start getting stressed and you hope nothing happens because you're not quite brave enough, and there's no judgment there, but you're not quite there yet to say, "No, I'm sorry, I'm going to have to get you to leave." Maybe you do, maybe you don't. This is just a scenario. Anyway, maybe you'd have done that in the past, and I salute you for that if you've made that decision, because safety first. The student may feel confused, a little unsupported, a little stressed, and they may not come back to your class. So that's the problem that we need to solve. And we're going to solve it by creating confidence in you through learning the basics tonight. Because you don't want to feel unprepared, imposter syndrome, and nervous when this happens, because it's horrible and these moments are tough. So what are we going to do about it? Let's go through that first little journey inside. So we're going to go through the 3 stages of pregnancy. We've got the first trimester, the beginning, the second trimester, and the third. And the stages of pregnancy are divided into those 3 stages. People say that the first 3 months after birth is the 4th trimester. So throughout the pregnancy, the fetus grows and develops, forming organs, tissues, and body systems. It's actually really amazing how that happens, and I'm going to show you that in a few seconds. The average duration is 40 weeks, calculated from the first day of the person's last menstrual period. So let's go. Trimester 1, 1 slide for each trimester. Remember, you can screenshot this. You can go, I've got a Mac, it's Command, Shift, and 4. You probably know better than me how to do it on yours. You can screenshot. You can also take the replay and slow me down. Or speed me up if it's too slow. So remember not to panic if I go through things quickly. So first trimester is the first 12 weeks. Fertilized egg travels down the fallopian tube. So it's fertilized already, down the fallopian tube, and it implants into the uterine lining. Formation of the placenta. Placenta is an organ that we grow ourselves to nourish and grow the baby. And it starts to connect to the embryo and then the mother's bloodstream is going in through that umbilical cord. We've got the development of the neural tube. This is something you have to go on YouTube and watch. You can watch amazing 3D videos, and you can also watch a funny doctor that takes a big duvet cover and shows you how it works. But at this stage, this neural tube, which will become the spinal cord and the brain, and then there's another tube that will become like muscle and connective tissue. It is fascinating how it works. It's just moving really fast, and it opens up and it closes and becomes a brain and spinal cord. Just go watch it on YouTube. The umbilical cord is forming, connecting the baby, and the fertilized embryo begins to form and consists of a cluster of cells. So there's little stages. It's 1 divides to 2, then it goes to 4 and 8, and it keeps going. And eventually then in the first trimester, before you even have any physical signs, usually, that little embryo already has little projections, little arms and little legs, but you wouldn't be able to recognize. I mean, if you were to see it on a picture, you'd say, not quite what a baby looks like, but getting there already, beginning to take shape. This is a good time to pause and talk about hormones. So why am I putting this in here? Hormones really, really increase in that first trimester. That's because hormones are messengers, are giving instructions into the body to do stuff. And if you can imagine how much needs to happen to grow a human, it makes sense that these hormones are going to start to rise. And so progesterone is one of them you may have heard of. That one acts as a progestation or pro-growth of baby hormone, supporting the embryo, and it actually slows things down. It conserves energy and it creates a stable internal environment. Many of its effects are protective. But they can also create symptoms like bloating, fatigue, heartburn, and constipation. So that's just the first of 4 things, and we're already feeling pretty rubbish. Not everybody feels rubbish at this point, but many people do. Estrogen actually increases 1,000-fold. This is increasing the blood flow, growth and function of the uterus and breast. You get sore breasts, sodium water retentions, all to do with creating an environment to grow baby. This is where we may get some emotional mood swings. And I think it's important to also acknowledge that this trimester is the most unsteady for people emotionally at times, because it's a new situation that they're getting used to. So we should be really sensitive to that as well. Estrogen contributes a little bit to getting a bit more flexible, but if we go down to relaxin, and how cool is that name, relaxin? All of the other things in medicine are so weirdly named, but this one I love because it tells you exactly what it does on the tin. So relaxin is a hormone that's going to release at this point, and it's going to relax the tendons, the muscles, the ligaments, and the reason for that is to open and create space in the pelvis, because the pelvis as it is now, when you're not pregnant, it would struggle to get the baby's head through the outlet at the bottom. But this actually causes a global whole body increase in flexibility. So we have to be really aware of that. That's a really important one for us yoga teachers to think about when we think about yoga students coming in who are pregnant. Then we have HCG. And this is the one that I think comes up. This comes up on the pregnancy test, the human chorionic gonadotropin hormone. That's why I said HCG. This hormone is made during pregnancy, and it's almost exclusively in the placenta. HCG hormone levels are found in the mother's blood and urine, and that's when they do the pregnancy test and they look for that. And this may contribute to the nausea and vomiting often linked to pregnancy. So I put this in here now because we've just looked at first trimester. If we just quickly go back, all of that's happening between 0 and 12 weeks from the last period. And all of this has gone mental. So 1,000-fold estrogen, HCG, relaxin, and you're going to feel pretty different. Most people do at this point, and it actually levels off in the second trimester, some of this. So the second trimester, oh yes, how are they feeling? That is a little bit of a mix of things. So we're still on first trimester. I just forgot about this slide. So first trimester with all those hormones, it's a little bit like this. Some people feel normal. They don't even know. Some people feel nauseous, fatigued, anxious, worried, and excited all at the same time. Some people just feel nauseous. There is a condition called HG, and it's extreme sickness and nausea. My sister had that, and it was dreadful all the way up to full term. She was in hospital. It was, almost impossible for her to keep the weight on. She had to have a drip. So all of that can happen, and at the end of the first trimester, we move into second trimester. Many people, I don't know exactly the percentage, but lots of people start to get their energy back now. They start to feel a little bit more themselves again. Of course, not so much in the belly area, because we're now starting to show baby's getting bigger. The baby experiences substantial, big growth. In the size and weight is increasing all the time. I hope you don't find that video creepy at the back there. That's my video of around about a second trimester. But the eyes may not have been open. I may have got that wrong. The lungs are continuing to develop, the respiratory movements, and the baby's going to start practicing breathing. Many of the organs and body systems are functioning, and they're nearing functionality. The baby's senses continue to develop. It can now hear sounds from the outside world. Eyelids and eyebrows are fully formed, and the baby's eyes begin to open. Oh yes, they do begin to open here, so the video is right. The baby's growth continues at a rapid pace, and their body becomes more proportionate. So if you saw on the scan, on let's say the 20-week scan, you're going to see a more proportionate picture of a baby on the picture there. Moving on to the third trimester. Third trimester, 28 to 40 weeks, altogether 40 weeks. Brain development progresses, the nervous system is becoming more complex and functional, The baby's position is going to shift with the head typically moving downward into the pelvis. So at this point, at some point after 30 weeks, we're going to start getting that turn. The baby's going to be up until this point. That's just how it forms. And then the baby's going to start to turn and go head down. Towards the end of the pregnancy, the baby's head will continue to go down and it will become engaged. And we call it engaged when it locks down into position for birth. The organs are fully developed and they're all independently functioning. And the interesting one here is the baby's growth slows down, but they continue to gain weight and size. So that we're ready. The baby's ready to come. And in the third trimester, we often see premature birth. So because the organs and the lungs are all working fine, the baby will survive or can survive if born in up until the 40-week mark from this mark. Let's go to red flags and conditions. So we've gone through the three trimesters. You've got a good idea now of some of the hormonal changes, the physiological changes. We're going to have a look at some more physiological changes, more that happen to the mum, to happen in the mum during pregnancy that can be a little bit uncomfortable as well. So let's look at blood pressure to start with. So let's consider that normal blood pressure is about 120/80 in somebody who's under 50 years old. In the early stages of pregnancy, the blood pressure drops. So that's just normal, but it can create dizziness and it can make them feel a little bit lightheaded and all of that. Later in pregnancy, second half, the blood pressure tends to come back to normal. So when they have their blood pressure checked, if it's 90/70, it would probably be quite normal. In fact, many people under 50 have a low blood pressure anyway. And just so you know, for the general population, we need to be drinking enough fluids as well. When we are dehydrated, that can that can lead to dizziness and, really feeling unsteady when you stand up because there's not enough water in the system that's being made into blood. So normal blood pressure is 120/80. You can take a screenshot of that, and that's normal in adults under 50. Symptoms of high blood pressure. We are going to go on to talk about a condition in a minute that is to do with high blood pressure in pregnancy. So the symptoms of high blood pressure in general: headache, visual changes, swelling in the hands and the feet, shortness of breath, loss of consciousness. That applies to as well as things like chest pain, arm pain, sweating, a feeling of dread. I've added the extra things that you would see if you were learning about high blood pressure in general. But that is what you might see in a pregnant person who is developing high blood pressure. And when they develop high blood pressure, it's a problem. It is a problem that needs medical attention straight away. It's not okay for someone who's pregnant to go high. It's okay for them to be slightly low. It is not okay for the blood pressure to go high. So I guess, and I want to keep bringing it back to yoga and teaching the pregnant student. Down the bottom, you're going to see that little yoga sign a few times. That's kind of a check for you and I to come back to the teaching situation. So all you can do is ask them to let you know if they feel unwell. There's nothing else you can do. You can't take people's blood pressure. You could ask them, have you had any blood pressure issues? That will be on the list of questions. But we can't do much other than ask. If they feel unwell, of course, please stop. And we err on the side of caution. So to add to your list, and I hope you've got a pen and paper and you're writing some of it down, just first things first, something to watch out for if they're in my class, if they start to feel unwell and they have any of those symptoms, headache, even abdominal pain or pressure, just people know when they feel unwell, and you tell them to not be afraid to interrupt you or leave the room if they begin to feel unwell. Next one is miscarriage, and this is going to be a little bit of a myth buster as well. So miscarriage is very, very, very common, but it's no one's fault. So I think that if we look back at the comments that I posted back a few slides ago from all the yoga teachers giving, by the way, they were all experienced yoga teachers giving advice to somebody that had asked a question on the Facebook page. and everyone's worried about miscarriage. And I think previously, whether that was 5 years ago, I can't remember now, or 10 years ago or more, everybody panicked that A, they would cause a miscarriage by doing something wrong, or that they would get sued by somebody if they had a miscarriage. Now, if we look at the evidence, and I've put a little link there to a study that was published in 2023, but you'll find tons and tons and tons of evidence. Never ever take my word for anything. Always be a critical thinker. If you're not sure about something and someone's just presenting it on a slide, go and do your research. Google Scholar is where you can look up research papers. Remember that when you read a research paper, it's normally peer reviewed, so somebody's actually checking that people are not writing things down that are not true. But there are lots and lots of biases that happen in research. That means that maybe the amount of people that they checked was a small amount, but they made a big conclusion. So always read a few reviews of studies, like a meta-analysis is a review of a bunch of studies. And then please always be a critical thinker. I think that's the most, they taught me this first year in my university course. Always be a critical thinker. However, I can promise you that there is no strong evidence that moderate exercise, so anything up to HIIT class, jogging, cycling, climbing, just moderate exercise, no evidence that it causes miscarriage. So that means that your insurance will cover you to have pregnant people in your class. And as you can see there, the vast majority of them happen in the first trimester, up to 12 weeks. So a lot of people say, like you saw earlier, don't let anyone in your room, don't let anyone in your class who's in their first trimester. And I say, based on the evidence, that's not necessary. There will be some considerations we need to make, perhaps, and some dialogue that will need to happen to make sure that we're both protected. But there is not even a little, there's no evidence at all that exercise and movement can cause a miscarriage. So yes, it's risky, 10 to 20%. That's up to 20%, 1 in 5 people. And I did read something the other day that said 1 in 3, so we need to fact check that as well. But up to 20% of clinically recognized pregnancies may result in, or no, do result in a miscarriage. So what can we do? So I took out a lot of information because this is a short session, and in the lab, in the pregnancy and postpartum section, I go much deeper into all of this. But I lost my train of thought there because I'm going off too far in my mind. Yes, what can we do about it? So there are some studies that say that, not having too much toxic stress, eating well, weight management, exercise. There are some things, but nobody will ever be able to promise you that if you're really healthy and you do all these things, you definitely will not have a miscarriage, because sometimes it's just genetic. In fact, I think it's a natural thing that's happening in nature. 20% of the fertilized eggs just don't quite work. And there'll be loads of reasons for that have nothing to do with you or your student, and it's no one's fault. There's no magic formula. So we're on to the next. So we're looking at, there's only 5 altogether, but we're looking at all of the conditions. We've looked at the miscarriage, blood pressure, and now we're looking at the diabetes and the preeclampsia. So diabetes, as you may or may not know, is a sugar problem. And I'm going to make it so simple because I'm not teaching a whole hour on this. 1 in 20 pregnancies somebody who did not have diabetes type 2, sort of type 2 presentation, didn't have that before pregnancy, can develop it. So this is where the body's ability to produce insulin from the pancreas to meet the increased demands of the pregnancy, it leads to elevated blood glucose levels, and it's a pretty bad situation. So although it's hard to spot, they may have the classic signs of diabetes. So really thirsty and then just bladder urgency. Can't stop drinking, can't stop weeing. It is a medical situation that needs to be addressed immediately. Again, at the bottom, ask them to let you know if they feel unwell. That's as far as it goes. Don't let anybody else scare you into thinking that if something you might do in a yoga asana class is going to give someone diabetes. And I say that because the other day I was doing some research for the adjustments course that we're doing in September, and I found a bunch of a bunch of Facebook comments. One of them, the person said that they had a bad adjustment and they had to have a hip replacement because of it. That is that doesn't exist. That, it's crazy to think that we could feel so responsible. That person probably told that teacher at that time, you made me have a hip replacement. You can't get a hip replacement from being adjusted. So also you cannot get gestational diabetes or high blood pressure or a lot of different things just because they came to your class. I just want to empower you with that. So nothing we can really do there other than ask them if they feel okay, if they feel unwell or they've got those, but like I said at the bottom as well, it's really good to have awareness of all of this. That's why I'm here. I think that if we know all of this, then I need to share it because then we can all just be really vigilant. The one at the bottom, the preeclampsia, that one is something we should really be vigilant of. Preeclampsia is a serious pregnancy complication and it's characterized by high blood pressure. So high blood pressure can lead to preeclampsia, and that is a problem with the blood supply to the baby through the placenta. So this is a medical emergency, and it's the reason why every single time a pregnant person goes to the nurse, the midwife, the doctor, the osteopath, or the physio, they will always take their blood pressure because it is a medical emergency when it happens, and it's not super common, but it's not rare. So symptoms of preeclampsia, they are the high blood pressure symptoms, headache, visual changes, sudden swelling. Now the swelling is really common in pregnancy, so don't go to your next class and think that when you see a pregnant person with swollen ankles that you've got, oh my gosh, she must have preeclampsia. Actually, it would be more a sudden swelling. Remember, in summertime, the body expands. I've seen so many pregnant people in clinic who are quite swollen. They don't have preeclampsia. This is a sudden swelling of both hands and both feet. Rib pain, vomiting. You are really, really unwell. Ask them to let you know if they feel unwell and you've done your job. Placenta previa. So there's a picture of the placenta. The placenta is this organ that we grew to nourish and grow the baby. It normally sits most of the time at the top of the uterus, sometimes behind, sometimes in front. Placenta previa is when the placenta is down at the bottom, meaning no exit for the baby. So sometimes it will move itself out the way, they monitor it, but sometimes it doesn't, and that means they will have to have a cesarean section. There aren't really, as far as I know, many reasons why that person would show signs in your class. So, but if they tell you they have this, then we know that maybe to take it easy because it's not quite a normal situation in their uterus at the time. Right, let's take a deep breath. If you're still with me, and I hope you are, close your eyes for a second, sit nice and tall, get the crown of the head up, lengthen, take a nice deep breath in, roll the shoulders back. This is exactly what I need. Anyway, as I'm hunched over because my chair's a little low. And then we're going to breathe a few breaths and just let that all sink in. So some of the main points that I've made are a massive amount of change happens in the first trimester. Hormonally, a lot of people feel very affected emotionally, mentally. They might feel really fatigued, tired, nauseous, and most of us are still working 8, 10 hours a day at this point. We might have a lot of other stuff to deal with at the same time, other kids, difficult life situations, whatever it might be. Second and third trimesters, that's when we start to, we've been in that situation for a little while, but we're now, physically changing, postural changes. We get things like pelvic pain, back pain. The body's changing physically. The baby's growing rapidly. And a few conditions to watch out for, mainly the high blood pressure and the diabetes. Pelvic pain is not dangerous and not a medical emergency and very common. And in the lab, I also teach about pelvic girdle pain, so we can learn about that later. And then the red flags. So this is a list of things that take a screenshot or write them down. This is a list of stuff that if they come to you in class, Wednesday, 6 p.m., 25 people, and they come in at 1 minute to the hour, and they say, "Can I join?" And then halfway through the class, they say, "I've got chest pain, difficulty breathing," or any of these signs, severe abdominal pain, vaginal bleeding, decreased movement or no, I mean, you're not going to really notice that so much inside of just your class, but these are just the things that we need to watch out for. When we are confronted in yoga teaching context, or even as an osteopath in clinic with red flags on the flag system means danger. It means directly to the hospital or at least onto the 111999. So that's what red flags mean, and I hope that makes sense. So we have other colors. There are yellow flags and blue flags and black flags, and we use that in physical medicine to help decide how we deal with symptoms and things like that. So yellow flags in the physio world, osteo world, in that world, they're usually psychological and social factors. So that's quite important with pain. But red flags, medical emergencies, off to the doctor, probably more off, even to be on the safe side, off to the hospital. And if you need help wording that, because in clinic it's really awkward when it happens because you think, right, I'm not sure, but I do think 210 over 130, that's probably a heart attack coming in a few minutes. So you're not sure. So what I do and what I recommend to do is you say to people, look, I'm not a medical professional, I'm a yoga teacher. I'm not happy with some of the things you've told me that you're experiencing, and I really hope I'm wrong. I'm probably wrong, but I'm going to send you directly to the hospital now or directly on the phone to call a medical professional. Let's just get you checked out. And you can give me a little slap round the head when you come back and you're fine, because you will be. And that's how I word it. I try and make it light. Don't panic people. Don't make them feel really, suddenly blood pressure can get a lot worse if you tell people, oh my, oh, it's really high. Oh my God, you're going to have a heart attack. They'll have one just from the comment. So that's how to deal with that. And down the bottom there, the yoga teaching point is it's not your job to identify red flags. Nobody's expecting you to spot them and not miss them, and it's not your fault if you miss them because you're not trained on that. But these are good to know because we're humans helping humans and we care. If a pregnant student becomes unwell in your class due to any of the conditions mentioned, it would not be because of something you did. None of it can be you. But you will read on Facebook and people will tell you that they think that it can be you and it's not you. There's no way. And you won't give them a miscarriage. We're going to talk about the modifications and the contraindications next. However, you will not give someone placenta previa, high blood pressure, pelvic girdle pain. One thing that can happen, of course, is injury, but these red flags and these conditions could never be your fault. Okie dokie, yoga during pregnancy. So what do we need to know quickly? Here you are, same scenario in the class. We are going to ask the following questions. Take a screenshot, take notes, digest this later. We're about to start our weekend. So we need to know which trimester they're in. And I want to make sure that you understand why. So you're asking these questions and you know why. And that fills the gap and solves the problem to make you confident accepting people into class. So as you can probably tell, I am going to say to you that you can definitely have a pregnant student in your class, and these are the questions. With the trimester, you're just establishing risks like miscarriage and preeclampsia. So if you look at the conditions, preeclampsia can happen more in that second trimester. placenta previa could be a bit of a risk really late in the third trimester, closer to birth. There's not much we can do with that information other than it's giving you more information about where they are at in that process. We know that the relaxin hormone is really high and all the hormones are very, very high in the first trimester. So maybe we can modify and not go so deep at that first trimester point. Maybe in the second and third we can ease off. So that's why we ask that. Do you have any pain or injury? So we know how to modify. Yes, I've got pelvic pain. And what I teach in the yoga lab is that with pelvic girdle pain, remember the pelvis, or actually just the ligaments, due to the relaxin, are becoming very relaxed, very stretchy, and they are much more flexible. So sometimes that combined with a few other things, there's always more to it than just that. It's not just the hormone, but that can create pain and predispose them to injury. And there are a few modifications for pelvic girdle pain that are really important. We don't want to get them doing intense pelvic positions. So we'll talk about that. Have they had or are they being investigated for any complications? Complications are these things, the red flags and the conditions. So if they say, yes, I am being investigated for gestational diabetes, they won't pass away or lose the baby in your class probably, but we don't know. We can never assume. And if they are investigated or being investigated, they might not really understand why, and it could be one of the red flags. So we just need to say no practice today. Has the midwife or doctor advised against any exercise or yoga? If so, there is a big problem. As you know, there's no evidence that exercise or yoga can cause a miscarriage. So, but there are reasons why with certain conditions, diseases, and all the other, injuries, there are some reasons why it might not be safe for them to practice or do exercise. It could be that they are borderline something. So if the midwife or doctor has advised against it, no practice today. And then at the bottom, ensure that they sign a disclaimer form accepting full responsibility for their pregnancy yoga practice. Revisit the form in the second and third trimesters because their health may have changed. Really keep a nice open dialogue with them. If you get the chance to have a phone call or a 10-minute chat before class with them, we can talk to them about the options they have. So let's assume that your class is a dynamic vinyasa and the person has been practicing for a long time. I suppose question 5 could be, have you been practicing already for a while? So their body is used to it, they know what they're doing. Then you could say to them, stay as long as you want. I'm going to give you a little, you could even print. I quite like the idea of printing out a little cheat sheet of the main modifications across the board that every pregnant person should avoid. And then you could even give it to them and say, do as you please, come as you please, and I will keep an eye on you. It's not a pregnancy class, so I can't give you one-to-one attention, but please check that list and, we work through it. And every now and again, I will help you. But if they are somebody who comes to you and they've never been to yoga before, they've never ever been, and somebody told them, oh, you need to go to yoga because you're pregnant, and they walk into your vinyasa class, I don't think it's probably the best idea because they don't really understand the practice. A beginner has quite a hard time keeping up, knowing all the cues and how it works. So they might be better off just going straight into a pregnancy yoga class. But there you go. There's quite a mixed, if you look at those comments from the Facebook, different people, different comments, the evidence is strong that there is no risk of the miscarriage. So, or no evidence of risk of miscarriage. So we don't have to worry that letting them come in, even if they're new to yoga, is going to be life-threatening to the baby. So a nice simple list in massive capitals shouting at you. Sorry about that. Six contraindications. Let me go through each one. I'm going to go through them pretty quick because we haven't got a lot of time tonight. And if you want to know more about this, there are so many ways that you can learn more about this with me if you want to, or I can send you resources. Breath holding. So there's some evidence that breath holding, big breath holds, will obviously affect O2 supply to the baby. And of course, I really don't think that holding the breath for 5 seconds is going to do any damage to anybody. But why don't we err on the side of caution? Because there is some evidence that it's not good. Pranayama techniques that overheat. So there are lots of pranayama techniques that are very good in pregnancy. And to be honest, if we look at even the Kapalbhati, if they did it in a certain way, and let's say they were 14 weeks, I don't think that it's a major risk. However, the system is quite hot. The pregnant student's going to feel pretty hot anyway. They don't get cold. They've got so much more going on in the body. The energy's up. So we tend to find on the pregnancy trainings, most trainings will teach that we do calming. Of course, there's loads of calming techniques we need in pregnancy anyway, but as a mainstay approach, just stay away from the ones that really overheat. Kapalbhati, shining skull, will also create a really strong compression down from the diaphragm. Try it yourself now. You can feel that actually it's more the TVA, the transverse abdominis corset muscle that squeezes in, isn't it? So it could probably really upset a baby in second, third trimester. So twisting can physically compress the baby and may cause problems. It's okay to twist a little bit though. It's not like we have to stop them from turning. It's more twisting from the belly, especially if you're in a position with the knee up and you turn towards the thigh. It will be difficult with the bump. You'll see if you've already taught people like this, you'll know that a lot changes. There's a lot of modifications that are needed, especially late second and third trimester. Open twists are good here. On the next slide, you're going to get some of the recommendations, but open twists means instead of twisting with the knee into the chest like this towards that knee, we can turn away. One thing I will say about twisting is that's one of these ones where if you look online and you Google, what can I not do in pregnancy in yoga, you'll see a lot of misinformation. That was my point that I was making with the slide about the Facebook comments. It's a minefield. It's a massive minefield because not only does Google hold old information, it holds stupid information as well sometimes. And sometimes people that have had one experience as one single human, they will then share that experience as the truth and they apply it to everybody. So that's called anecdotal evidence, and it's not very strong because we need to test something on a lot of people to get like a good answer, a good result. So when we go into second, third trimester, there's going to be quite a postural change, and we talk about that a lot in the biomechanics. The posture changes a lot. The pelvis is going to tilt forwards. The breasts are getting heavier. We round through the upper spine, and then going into postpartum, the upper spine, the thoracic spine, is going to be so flipping tight. Every single new mum that I see for a mummy MOT appointment it's like you can knock on the shoulders and you can hear it like it's wood. So doing some really intelligent cueing and intelligent twisting during pregnancy is okay, and we shouldn't just completely avoid all twisting. But if we think about it physically, turning into that leg or twisting too far could upset the movement of the uterus. If you look at a picture of pregnancy over 30 weeks, there's not a lot of room. There's not a lot of room in there. All of the intestines have been all pushed up. So we want to make it easy for them. Overstretching is the next one. So relaxin is really surging in the first trimester, but does make you more flexible all the way to full term. So this applies massively to our hypermobile people as well as everybody else. Hypermobility means you've already got it's not relaxin, it's a connective tissue disorder, but it's similar. It's going to, you're more flexible than, say, the average. So overstretching is a contraindication, but again, I teach a lot around it depends, because some hypermobile and very pregnant people really like a stretch. So we shouldn't go around telling everyone, don't do that, only go 50%. But there's a lot of really good benefits to pulling them back. We need strength, we need squat strength, we need glute strength, thigh strength, we need upper arm, upper body strength in for birth. And there's so many positive ways to swing this. There's so many ways we can say, hey, why don't we actually make this a positive? Instead of going so deep into that warrior two, let me give you two really nice benefits from pushing you back. It's going to maybe help you to work with your pelvic floor and pelvis for the birth to give you a better birth. That's the overstretching one. Lying supine, which means on your back after 15 weeks. Lying on your back becomes a little bit dangerous because the vena cava, which is the big vein that runs through the center of your body. So your heart is on the left and you have the aorta coming out the top, which is the big red one. Remember, I'm talking anatomy book. The big red one is the aorta. That's giving oxygenated blood. It's a very big artery. It then branches off into hundreds of thousands, if not millions, of smaller arteries. Same with the venous system. You have the venous vein coming back into the heart, and it's when we lie on our back, when we are over 15 weeks pregnant, we can accidentally compress the vena cava. It's a bit of a design fault, to be honest. Lots of pregnant people, especially the 3 midwives that I treated in clinic a few years back who taught me so much about midwifery, they said, yes, it's true. It can happen. But before it gets to the dangerous point, most pregnant women will feel lightheaded and start to feel funny. And that's when you turn over to the left, for example. Left is the side of the red of the aorta, of the branch going down. So turn to the left is what we say to do in yoga for pregnant people. As soon as you do that, it feels better. Lying prone after 10 weeks, hopefully that is self-explanatory. A little mention on mental health and emotional health. 1 in 5 pregnant people will experience a mental health issue during and after pregnancy or after pregnancy. Most commonly anxiety and depression. The first trimester is particularly vulnerable due to hormonal shifts, uncertainty, and physical symptoms. Previous mental health history increases the risk of antenatal depression and anxiety. So it's really important to have the open conversation if you're concerned about somebody. Midwives and GPs are good points. There are so many NHS services, depending on where you live, that have dedicated specialist trained midwives that are mental health nurses. And, we need to just open this can of worms and keep getting it opened. It's so normal to suffer with trouble in general. And it happens to, probably more than 1 in 5. 1 in 5 is what I found in the research. Yoga and mindfulness is often recommended as a non-invasive, non-confrontational practice. We don't advise, we hold the space, and we offer techniques that may help, but we cannot promise this. We can't promise that it will help. But how amazing, like just a quick shout out. I love fitness instructors, but I didn't mean to say just, it's just because I'm making a point. But if we were fitness instructors, it'd be different. But yoga has that little special edge. We've got the mindfulness, we've got this, how much research is coming out about meditation and breath work and all of it and the benefits of it all. So when it comes to mental health, we don't advise, but we know that there's lots of evidence that if they can sit in your class and they can make it through your class and they feel like it's helpful, then that's great. But always refer them if they ask you, I don't know who do I talk to, find some people that you can signpost them to. So we're almost done. Modifications. So open twist I spoke about is where we don't twist into the thigh if we're sitting. I've just forgotten the name of it after 11 years. I can't remember the name of this pose. Sitting up in staff pose, Dandasana, draw the right knee in and do the twist. It's such a basic normal pose. I just can't remember exactly what to name it. You are welcome to unmute if anybody's still there and tell me the name of that pose. So the closed version is towards the thigh and the open version is the other way. So we can turn, like I said before, we need to work a little bit on upper back twisting. We can take a bolster and a pillow for lying supine. It's okay for them to do Shavasana, lying on a bolster so that they're not lying flat. We can lie on the left side for vena cava. That's the vein that can become compressed and cause a problem. It will cause a big problem if it's ignored, by the way, because it does completely cut off the blood supply going back up to the heart. Education is so important on the overstretching. So it's kind of having that conversation, not being too bossy, but having that conversation about the benefits of not overstretching and balance issues. So when you're in Tadasana, standing up, take the feet a little bit wider. Achy joints, pelvic pain, all of that, we can take a blanket and a towel for comfort. Sometimes it can just be nice, even if they didn't have it before, to have some sort of support on the hard floor because it can be a little bit painful on the hips. And sometimes if they have bad pelvic pain, they won't want to sit on just wooden floor. Okay, so just see how we're doing. Oh, hello. Have I stopped sharing? Can you see me? Okay, great. So I've got just one more thing to say on the slides and then it's Q&A. We've got 2 more minutes to go. I've done it, done the time. Do you like everyone who's watching and anyone watching the recording, how hard is time management? Can I get yes? Or are you like, no? Because like, is it just me? So let's just go back here. So I am super excited to finish the whole presentation and tell you about the Yoga Teachers Lab. Marua, who we've got in the call at the moment, is one of our founding members. Most of you and lots of you that signed up for this recording have been members in the Yoga Teachers Lab, the free version. I created that 6 months ago as a place for you to come and try and learn and get lots of value from it. But the plan was always to launch this in-depth CPD, so continuing professional development, the YSAP, the little stamp you can see at the top there. I've registered as a Yoga Alliance continuing education provider so I can give certification on all sorts. And I created the lab, and inside the lab there is a pregnancy and postpartum, and I'm so excited to teach everybody about the postpartum side. There'll be another workshop soon on postpartum. It's so amazing with just a few little advisories and just learning a few little tricks. We can make a massive difference for postpartum bodies that are struggling with pelvic floor. 50% of women will go on to actually have a pelvic organ prolapse, and so many of us end up with a tummy gap that goes too far, and we're not really given very much support, especially here in the UK. Almost none. Almost none. So this is where, as yoga teachers, I'm so excited to get more yoga teachers up and running on that knowledge of the mummy MOT and the postpartum physiotherapy that I practice. So the Teachers Lab is an app. It's self-paced, and the difference between my free version and the new paid version that's launching right now today is that the free version has an anatomy refresher in the classroom and the occasional live like tonight, but the pro version has 10 classrooms. So go into a corridor in your mind and look at 10 doors. Each of those doors, open the door, and inside that door is a teacher with a different subject. So each room is different. So each classroom has lots of different classes in it. So for example, in the Applied Anatomy and Physiology lab, you'll find Module 1, the skeletal system, or Module 2, the systems. And I'm going to grow it every week. It's going to keep growing. I'm going to put quizzes in there, resources, downloadable templates, absolutely everything. Everything that I've learned over the years, 11 years of teaching yoga and 9 years of teaching yoga teachers in anatomy and everything, modifications and all my osteo knowledge. I'm going to put that in, and I really learn well with some of the online courses that I've taken. I've taken loads. I am one of those people who takes a million online courses, and so I've taken all the best bits. So I've listed them all there. Anatomy, physiology is one classroom. Injuries and conditions, hypermobility, arthritis, disc prolapse, everything. I'll keep going until I've done them all. Modifications lab, there'll be an asana lab in there as well. Pregnancy and postpartum, yoga, business and mindset. That's kind of, I think Daphne and I were talking about how it'd be nice to talk about how do you actually grow a class? When you do a workshop, what's the steps? What do I need to set up? How do I run a retreat? What kind of spreadsheet? I've got spreadsheets and everything that have really helped me to go from my first retreat where I made minus £500 to my third retreat where I made £2,500 for a weekend. So Everything that I've learned over the years is going in there, and all of the founding members, the 6 founding members that are also going to offer whatever they feel they're confident in. It might just be a chat, it could be a yoga lattes class. We've got Beth, who's yoga lattes. We've got Ifalays, who is a psychologist or has done a degree in psychology and is going to teach us around trauma informed. We've got a philosophy teacher coming as well, and it's really cool. Sequencing, specialist yoga lab. So that's the lab. What I've done, instead of keeping you on any later, I have sent you in the chat, also it's in the email that's coming out with the recording, a 1 week trial. It's easy. You just have to click it and take the 1 week trial, come and see the lab. If you really like learning about topics like pregnancy and postpartum, the Lab Pro is where all of my energy, I've literally sold my entire clinic. I did that because I'm moving to Brighton as well, and it was perfect timing. I've changed my entire life to become almost a full-time trainer. So I'm going to be pouring my heart and soul into this. The best thing about the Pro as well is the weekly live training. So every single week, Q&A, there's like a Q&A session, and there's one-to-one support as well. And you'll see that there's an annual option, and that gives you all of that. So I'm going to stop sharing that and come back to you. And maybe you have any questions. If not, thank you so much. And I can't wait to see all of you. I know all of you. I'm going to stop recording.